All right. Good afternoon, everyone. This is Jason Crosby of Strategic Healthcare Partners. I'd like to thank you for attending our presentation today on best practice analytics in today's physician practice setting. Our goal in this presentation will be to illustrate real-life scenarios taking place in everyone's practices and how these analytic services and platforms can help with the necessary solution and action plans for such cases. Hopefully you all will walk away with how such a combination of the technology, the analytical support, and market knowledge can help practice grow, as well as making everyone's job easier and more streamlined. So after a brief introduction, our senior analyst, Chris Campion, will take approximately 15 minutes, and he'll walk us through a few actual case scenarios brought to us by our clients. We'll then break for a couple of minutes. We'll answer some questions. And then Chris will dive into our analytics platform for roughly another 15 minutes or so to sort of drive us through the other various uses of the solution. We'll then wrap up with any questions you all may have. For housekeeping purposes, we have muted all the lines. So if you have any questions, please feel free to enter them into the GoToMeeting chat box. And we'll be sure to address those during our break or afterwards and follow up accordingly. So with all of that, let me first introduce who we are, Strategic Healthcare Partners, SHP. We're a consulting firm, approximately 10 years old. Our niche and what we are focused on is managed care contracting, provider enrollment, data analytics, IPA management, and clinically integrated networks. Most of us come from a provider background and have worked in the trenches just as you have and are doing today. So with that, we sort of feel your pain. So we're going to dive into the weeds here, and with that, I'd like to hand it over to our presenters today, our senior analyst, Chris Campion. Chris?
All right, thanks, Jason. So the theme I really want to focus on today is all about going from data to action. And it starts with using our web tool powered by Dashboard MD, and we can provide your practice with an easier way to access information as well as just your data. And together we can use high-level dashboards to identify areas that require attention and then dive down to that transaction level to gain a deeper understanding of the issues. And we're familiar with all the major practice management systems and never afraid to learn new ones, so you can always get the most out of your data. All right? So using your practice's data to find those potential issues or areas for improvement is really just that first step. And our objective is to help you transform that raw data into an actual action plan that you can feel confident will make your practice thrive. As your partner, we'll be with you all the way from insight to action. So with that, let's dive into a couple of examples of just how we do that. So scenario one, a practice is offered new rates on a fee schedule. Should they take these rates or start a negotiation with the payer? We recently dealt with a payer who sent out these notices that they were going to change the base rate of their fee schedule from 2017 Medicare from 2009 Medicare. Now, practices had 30 days from the date of the letter to respond, or they would be automatically opted in and receive this new fee schedule. So, if this was your practice today, how confident would you feel about making this type of decision? And out of the thousands of codes that are going to be paid differently now, which ones really affect you and your practice? So for our clients, the answer was very confident, because using our analytics tool, we were quickly able to extract all of the data needed to model the impact of this contract based on what that practice actually uses for services. We then load all of that data into a model that breaks down by the different service categories just how the change would affect the practice. And where a typical practice might spot check a couple of the major CPT codes, we can tell you if the gains you get for certain service types like E&Ms might outweigh the losses you'd see in surgical reimbursements. And we're also prepared to move right from this model, evaluating the new rates, into a negotiation if that's the answer that's best for you and your practice. All right, let's look at another scenario. A client was loaded onto the wrong fee schedule after negotiating a new contract. Now, as your partner, we like to do periodic reviews, and in this case, we found the client was being underpaid because of that error. So, thinking about your different contracts with all the payers right now, how confident can you say that your practice isn't currently being underpaid on any new contracts, or maybe even a long-standing one. So what was worse for this situation was, even though the payer acknowledged their error and said they would load the practice onto the correct fee schedule, they did some calculations and determined that the practice hadn't been underpaid significantly enough to qualify for a claims reprocessing project. Now, we knew right away from our initial review that was not correct. The same day that we got the reply from the payer saying they're not going to do the reprocessing project, we used our analytics tool to get the actual reimbursement of every claim paid incorrectly since that new contract was loaded. We pushed all of that data into an underpayment model, and again, that same day, we were able to send the payer a report that showed the true underpaid amount was 4 times greater than what their calculation was. We had all of the raw data to back up our claim too, and they didn't really have much of an argument at that point. A few days later, we got the notice that they were going to begin a reprocessing project. So in this next scenario, let's look at a more internal issue that I'm sure you've encountered before, and that's charge lag. In this particular case, it was a practice who closed their ASC that happened to be in the same building their doctors were performing, their regular practice at. So instead of being able to, do their surgery, go back, see a patient, your whole day is in one building, they were now having to go over to the nearby hospital to do any surgeries. So no longer could they just walk downstairs after surgery, hand in their charge slips to the front desk, and go on with their day. Now they might be at the hospital for the most of the day, go home, they might go back to the practice, they might spend their morning in the practice and afternoon in the hospital. And it really didn't take long before just that change of habit made it so that the charge slip hand-in process kind of broke down. And at that point, their charge lag started to grow. Now, sometimes these changes happen to a practice and it's beyond everybody's control, but if this type of a change happened today, how confident would you feel that you could manage any potential issues like charge lag from getting out of control? So because we were their partner, we regularly checked in on their key performance indicators through our analytics dashboard. And we were able to hone in on those providers that were still sitting on their charge slips shortly before the month ended so that they could be collected and billed. Now, we also built a model allowing them to look at past charge volume that they had done at their ASC and use it to project forward what we would anticipate they would continue to bill. And we added a heat map sorted by the provider so the practices could again identify which providers, based on our projected variance, needed to be reminded of handing in charge slips. It's a lot easier to get somebody to hand in a charge slip if you can say, we're expected to come up $30,000 short on charges this month based on what you would typically bill if you don't hand in these charge slips, rather than, just the continuous kind of, hey, we need those charge slips conversation. Now, in this last scenario, we're going to talk about a practice who actually had the luxury of having some time to really dig into the data themselves. Now, the practice had identified an issue with patient collections, but what they wanted to do next was more than just talk to the front office, because they wanted an action plan, and that's exactly what we did for them. So it started with a practice manager doing a typical check on an AR dashboard through the web tool. They didn't really like what they were seeing, so they started to do a little digging. They went into the ad hoc builder section of the web tool and pulled up the recent patient accounts with the most outstanding AR, and the numbers they saw were way above their target thresholds. So at this point, they have a problem. They need to take some action. All right, so what we did for them was we took that data the client produced, plugged it into our patient liability report that helped display the trended patient AR with percentages of collections. And here we could play with the targeted collection efforts, in all 3 stages: the upfront, the statement, and then the collection company style collections, and really help them develop an action plan of how to improve all 3. We did some upfront training for the upfront staff. We also gave them a patient liability estimator tool, so when the patient comes in for specific procedures, the staff kind of know about how much they need to ask. We help them refocus their statement as well as their collection company efforts to target the specific accounts they really needed to get back to. And in 6 months' time, we saw a marked improvement in collections each month, even in the face of downward charge trends. So you can see the spike in the monthly amounts, particularly on those upfront collections in the 0 to 30 bucket. Again, while the charges are not even average for what they had previously been doing. All right. Take a bit of a break.
Yeah, let's take a break. We have a few questions. Thanks, Chris. That was a great dive into some actual and practical uses that our clients are encountering. We have a couple of questions, so let's take a moment to address, if we will. First, so how often does SHP perform underpayment reviews, and what action do they take to seek recruitment and proper fee schedule loads?
Oh, that's a great question. So we do the underpayment reviews periodically throughout the year, or when any major change to the contract has occurred. So if you negotiate a new contract, typically about 3 months in, we want to make sure that you're getting paid in according to the new contract terms. Or if there's a yearly update to a schedule, I know Blue Cross tends to do, I think it's in April, they push out their new contracts, and you know, they tell you this is what you're going to end up with, but we'll do a before model where, okay, here's what we would expect it's going to do for your practice, and the after model saying, okay, you know, you've been getting paid on that schedule for about 3 months, and it looks like they're paying you in accordance with what they said they would. Other than that, you know, it's as needed. You know, when we go into a practice, we'll go ahead and take care of the major payers right away to see how you're doing. Other than that, it's about every quarter to 6 months. Once we get that together, though, then it's just submitting the data back to the payer. And we've got a great contracting department that has excellent relationships with all the major payers. And you know, we've been working on this type of stuff with tons of clients for quite a while now. They know who we are, and we mean business when it comes to our clients.
Good point. Good point. The data is only as good as if you know what to do with it. All right, we have another question. I am busy just trying to keep the practice running. So what would you do to help us find where to start improvement?
You know, that's a really good question. It's actually going to be kind of where we're heading next in the presentation. You know, too often we see these administrators or practices that just kind of feel overwhelmed. They're really just trying to keep things moving, don't have a ton of time to dig into, you know, all the fine points of their practice and go even further at that point to really develop a growth strategy or an action plan. So that's something we can look at and maybe use the tool to do.
Fantastic, fantastic. All right, well, we've talked through some good common real world headaches that everybody faces. Connectivity obviously being a key, as everyone sees throughout Chris's scenarios, and what to do with such actionable data. So with that, Chris, let's go ahead and take a look at some more scenarios, as you were just alluding to, and then we'll dive into the tool afterwards that touches on these very points.
Right. Okay. So, you know, it was that scenario we were just asked about. The client feels like they are flying blind. They're bogged down with their day-to-day operations and doesn't have a lot of time to actually run out some reports and get a sense of where the practice is going, and even further from that point, develop it into an action plan of where do they want to go. So let's actually go up into the tool. We'll run a couple of reports that we would typically do with a client when we first start with them, and we'll kind of go from there. So this is the web tool. It's a really user-friendly area. It's browser agnostic, so whatever your preference, IE, Chrome, Firefox, it doesn't matter. It works great on all of them. For this case, a client who kind of feels like they're flying blind, what we would tend to run is a couple of key reports. So in this case, a KPI matrix is a really great place to start. So we'll bring this up. This is a saved report that I've got going here, but we can show how it breaks down and how you could actually build this if you wanted to. What we're going to look at is the major KPIs that we think are pretty important. There's a lot more KPIs we can look at, all these key performance indicators here. So this is our report. These are all the different KPIs you can get into, from average billings, all these adjustments by patient, procedure visit, charges, number of patients or claims, payments, and then into the RVUs. But we can look at this starting at the most recently closed month, in this case September, and it's going to look at the last 12 months going back to October of 17 and how your practice has performed on each of these different KPIs. So you'll see it actually has the actual bucket for the real values, the percentage of goal, which is how it's doing in accordance with the goal that the practice has set. We typically do a default of a rolling 6-month average. If your practice wants to make some custom goals, that's absolutely fine, and we can help you do that, both determining the goals and getting it set up in the system so that you can see how you're working towards it. You'll also notice a little color bubble next to the goal, and that kind of indicates as to how you're doing. But just some people are more visual, whereas some kind of use the numbers, but it kind of gives you a sense of where you need to look at your focus. So, red, for instance, non-contractual adjustments listed in August is a red bubble. That means, you're way off your goal. This is an area of concern. You got to focus on this. Yellow is, slightly below goal. Green is at or just above goal. And then blue is well above goal. So it really helps you see where you need to work on different KPIs, but also where you need to give credit or recognize some strong performance. In this case, the average days to post for September was above goal by quite a bit. Maybe you need to talk to your billing department and make sure they feel rewarded for the good work they've been doing. So we can also, slice and dice this up by a number of different ways, looking at all these different ways to filter. Right now, we've actually got it set to facility. So if we take a particular KPI, in this case, let's look at gross charges. We just click on that. It's going to load it up, and it'll actually break it up into the individual facilities that are responsible for that total gross charges. And you can see how it breaks down right here, all these different facilities and, how they're doing. In this case, it seems like only 2 real facilities are the main components of this. You can also, it's already sorted in this fashion, but you can sort on the goal. So just by doing that one little click, it's going to change how it looks. In this case, again, it is already sorted, but all of these reds will bubble to the top if they're not in particular order. So really great way to dive in and get a sense of just how your practice is doing right now and how it's been doing over time. This particular report is exportable, so we can put this to a PDF or to Excel, whatever you need it to be. And in that way, you can share this information with your staff. You can have this type of report printed out, given to all the regular people that need it. You can also subscribe to the report. So this little email icon, that's going to give you the ability to have this come on a recurring basis, daily, weekly, monthly, however frequently you would need a report. And you can actually have it sent to different people as well. Whoever needs this type of information, it can just be sitting there in your email for you whenever you're going to need it. Okay. So let's look at another really good report. In this case, we're going to open up our most popular, and we'll look at the executive summary dashboard. So this is done on post date, but it's a really great report that shows a lot of high-level information. And we'll actually build this one so you can just get a sense of how quickly it goes. Again, we're going to go from the last closed month of September, and we're going to select just our multi-specialty group at the moment, and we'll grab all the facilities. So we've got all our values. We'll run the report, and while that's running, we can actually go over to the report section, just so you can see that, again, it's going to bring you to the most popular reports, but if you switch over to all, it's going to show you all of these different, on the left, buckets of report types. So you can really hone your focus on what you need to get to for information and kind of go right to the bucket or area that you need to focus on. And then it brings you over to all the different reports that are listed, and you'll see all the different ways you can view information. So dashboards, tabular reports, which are more like matrices or tables, scorecards, exports. They also have charts and graphs, gauges, trended reports. There's a lot of different ways to digest information, so you got to do what's best for you, how you most easily learn from the different information available. But this report's up now, so let's take a peek. So again, this is a great high-level report to get a good feel of how your practice has been doing over time. So it's going to look at the 12 months prior to the month we set of September. So again, October 17 to September 18. We'll look at the volume of patients and procedures, your charges, your adjustments, your collection rates, and your AR. And again, it's great to have this type of information in a number of ways where you can see it both in the hard numbers as well as a nice little visual representation of the graphs below it, and see all the peaks and valleys of your practices. And for the charges and collections, they're kind of intertwined. The more you charge, the more you have to collect, how they kind of work in tandem with each other. So that's a really great way to start and get a good sense of how your practice has been doing. But let's go on to another report as well here. Let's actually go to a dashboard. So we'll go to the dashboard section, and let's look at appointments. So we'll open up this appointments dashboard, and it's going to give you 4 different things to look at here. In the top, we've got our 2 main pieces, which is going to be our visual bar graph representation, and again, the hard numbers. So again, it's looking at a 12-month period. In this case, current month for appointments is fine. We'll look at November 17 to October 18. The bar graphs in the top left, the entire bar represents your total number of appointments. And then you can see the colors for each of the mini bars inside it represent no-shows, canceled, bumped, booked, which really only applies to the month that you're in, because obviously booked appointments haven't fallen into any other buckets yet, and then arrived. So you want to see your arrived bucket being the biggest piece of your bar by a lot. It's good to see that. But you can also look at it in that numerical format with the arrival percentage, your no-show percentage, and get a sense of how things have been trending over time as well. So down here, we've got a couple of other visuals. These are going to be a trend on the left. It's looking at the major appointment types of what the patient's coming in for and how they've trended over time. We can also edit that time. So we can, move it down to just a 6-month period just by dragging like that, and it'll refocus that trended line. We can also change. Right now it's set by that appointment type. If we wanted to change it to a different dimension, like, the patient age band, we can look at the different rendering physicians and the arrived counts for each of the physicians, which is, actually what we've got going on over here in this period comparison. So this is a great way to look at the variance between 2 set times. In this case, it's a year period from 16 to 17 and a year period, same time frame of 17 to 18. And we've got it set by the rendering physician and their arrived counts. So you can see the arrival count is kind of down across the board. Eloise and Scarlett Kemp being some of the big losses on that one. And what's great is, all right, we're looking at a dashboard. We've identified a particular problem. Our arrival count is down. Let's dig into it. So there's this advanced query button, and just with a quick click, it's going to take us over into the ad hoc builder, where we can really dive into the information. And again, while that comes up, we can see over here in the ad hoc, very similar to the report section. It's got the bucketed areas that you can build reports from, and it's going to show you, based on what you're clicked on right now, it's appointments, all the different measures, appointment count, booked count, bumped count, and all the dimensions that are going to be available to you. And if you go over to financial, it'll show you different measures. Okay, now we're looking at charges and payments, things like that. So it helps you really hone into the specific information that you're trying to get to. But we've got our report up. This is that same information in a tabular form. We can put it back into that graph format, and we can make some changes here to kind of play with how we want to look at this information. So let's just do something like, all right, our arrivals are down, our appointments down. Well, let's change the measure. We want to look at the actual appointment count, and we'll just hit apply. And what this brings up, it'll shift the entire measure. So no longer we're looking at the total arrivals, we're going to look at the total number of appointments for these top 5 providers right here. And we can see Eloise, who had 532 less arrivals this year compared to last year, has had 70 more appointments. That is a clear problem, right? Scarlett is still down on appointments. It makes sense that she should be down on arrivals. But Eloise, there's something going on. We need to look into, the particular types of patients that are coming in and maybe see if, they're getting bumped and it's her schedule that's got to be worked out, or, there's a lot more no-shows coming in. Maybe we need to see if there's a particular referring provider that's just not really doing what they should be doing, which is referring patients that are going to show up. So, we've looked at the major 3 sections of the tool now, the dashboards, some static reports, and this ad hoc builder. We can export all of this information as well to a PDF or Excel, but it really gives you a sense that you can get from that high-level information to, that particular, what is the issue, the core issue that's feeding up to that high-level information. And from there, you can turn to a partner like SHP that's going to help you make that action plan about how to go forward. So, I hope you found this information useful. I'm going to turn it back to Jason now, and we can take any further questions.
Fantastic. Thank you, Chris, for that great presentation, well laid out. Walking through all those specific and applicable scenarios of fee schedule modeling, underpayment analysis, charge lags, patient collections, issues that all practices face and that we continuously hear about. So hopefully everybody was able to take away something from this, and Chris was able to shed some light on not only to overcome these headaches, but hopefully help each practice thrive. And while data is king, it's pretty much meaningless without market savvy sort of interpretation and respective subsequent action. So with that, we do have a couple questions. I'm going to throw out at Chris. We have some very particular month-end reports we run that take a couple of days each. Is it possible to automate these?
Yeah, absolutely. I didn't touch on even a fraction of how many different reports are in that web tool. You can really, there's no limit to what you can do with the data when you've got a powerful tool like that. Even just using the ad hoc builder, we can put together just about anything, mix and match the data in whatever format you need to make sure that you get the information that is going to better your practice.
Fantastic. And I oversee a practice that uses a different PM system for our ASC than what we use for our practice. Is there any way to look at information from both?
Absolutely. If you were to connect both the ASC and your practice, we can feed it up into a nice little enterprise area where you can look at both in the same report. Up in the tool, it actually had that multi-specialty organization and an internal medicine practice. They're on different EMRs. It doesn't matter. We feed it up into that area because once you take the data out of that EMR and put it into this, processing cube, you can really do whatever you need to with that data. So creating reports that look at both, look at the individuals, look at a single provider across both if they do work and they're going to work in the practice as well as the ASC. It's all within the realm of possibility, and it's pretty powerful to be able to save that amount of time when you don't have to run reports out of each and then put them together. And maybe different EMRs, the format's different. You got to scrub things before you can even get to the part of the information stage. We spend too much time working with the data. We need to go right from the information so we can get to the action.
Great point. And as everyone sees on their screen, while we touched on a few scenarios and Chris dove into the tool, you'll see there's many other applicable reporting and analytics that's able to be provided. And if you're interested in a population health or clinical module, please look for those similar presentations that we have for folks to register. That portion of the solution will help resolve any of the care gap issues or coding for value-based care arrangement. MIPS reporting, which is a headache for everybody, and any network type needs such as clinically integrated network. So a variety of solutions all embedded within the type of platform we just viewed today. Again, we want to thank everyone for their time and pretty much have a wonderful, fantastic rest of your day, and we will follow up accordingly with those that emailed us other questions. Thank you, everyone.